Welcome, everyone. Thank you for joining us today. If you're joining us on YouTube, thanks for stopping by. We are so glad you're here and invite you to subscribe to our channel for more videos on all things aphasia. This is Ask the Expert. In this series, experts will be answering your questions related to aphasia. I'll be your moderator for this hour-long session. My name is Jen. I'm part of the team at the National Aphasia Association. This year, we are celebrating 35 years of support, providing access to research, education, rehabilitation, therapeutic, and advocacy services to individuals with aphasia and their care partners. Today, we're joined by Dr. Sharon M. Antonucci. Sarah is a researcher, speech-language pathologist who specializes in aphasia and the clinical director of MossRehab Aphasia Center in Pennsylvania. Today, Dr. Antonucci will be talking with us about animal-assisted therapy. Then we'll open up the floor to those in our live audience for questions. Sarah, thank you so much for being part of our series.
Thank you so much for having me, and it's no problem at all, but I'm Sharon.
Oh my goodness. I am so sorry.
That's okay. That's okay.
I do know your name is Sharon. I am so sorry about that.
No worry about it.
A major fail on my part.
I didn't want to confuse people because with the written name.
Yes. So Dr. Sharon Antonucci, I am so sorry.
No, it's no problem. Yes, hi, I'm so thrilled to be here. I am indeed Sharon Antonucci, and I am the director of the MossRehab Aphasia Center. I have been a speech-language pathologist since 2001, and I have been working with people with aphasia for the majority of that time. And I'm thrilled to be here today to talk about animal-assisted interventions, specifically related to people with aphasia. So I will go ahead and share my screen, or share my slides at any rate. Okay, can everybody see that? Black background, animal-assisted therapy. Hopefully everyone can see. Okay, so the first thing I am going to do is just a little bit of defining terms. And the first thing we'll talk about is, what is animal-assisted therapy? Animal-assisted therapy is just that. It is treatment that requires a licensed clinician, such as a speech-language pathologist or an SLP. It could also be a recreation therapist, physical therapist, occupational therapist, etc., who is providing treatment to their particular client within their own scope of practice. And so within the context of the treatment, they're working on client skills, whatever skills they've decided that they would like to work toward, to achieve their own personal treatment goals. Animal-assisted therapy, or AAT, is a treatment method. It encompasses a wide variety of activities that help the client work toward their goals and that also incorporate the animal. The person who's handling the animal, that's kind of the terminology we use, might be the clinician themselves, or the clinician might be working with someone else who is handling the animal as part of the animal handler team. Animal-assisted therapy is just one example of a type of intervention that's available under that broad umbrella of animal-assisted intervention. And it, I think, is important to differentiate animal-assisted therapy from some other kind of common things that we see that involve animals. One of which is animal-assisted activities. And in this case, the animal and handler team provide what you might think of as enrichment. A licensed clinician is not required. There's no individual treatment happening. And the team is available, the animal handler team is available to a lot of different people at the location. And the interactions are relatively spontaneous. And so examples that you might have seen or heard about would include things like the animal handler team visiting people in the hospital, going to a library so that children can read to the animal, and even visiting college students during exam times. Another thing that animal-assisted therapy is different from is people who have service animals. A service animal is paired with their particular person, typically that they live with, who is trained to do specific tasks for that particular person. Service animals have federally protected public access rights, and so they can enter any public place with their person that they provide service to, for whom they do the specialized tasks. And service animals are working animals. And so that's why when you see a service animal out and about, they typically will have a vest on or something that indicates that they're a service animal. And you're asked not to talk to or try to pet the animal because the animal is busy doing their job. And also, if you ever are approached by a service animal without their human, it's probably a good thing to be aware of, because that service animal might be trying to get your attention because their human is in need. Under the Americans with Disabilities Act, the only animals that can serve as federally protected service animals are dogs and, in some cases, miniature horses. And that's different, actually. That's a much more restricted category than the kinds of animals who could participate in animal-assisted therapy with a licensed clinician. So in terms of the non-human animal that is involved in animal-assisted therapy, a big requirement is that the animal actively enjoys being around people, and that they seek out attention and interaction with humans. An animal should absolutely not be doing any kind of animal-assisted intervention, and certainly not animal-assisted therapy, if they just are tolerating interactions with humans or if they actively dislike interacting with humans. It's not something that an animal should be forced to do. It should be something that they do when they want to do it and because they actively enjoy it. Animals who serve in the context of animal-assisted therapy have been assessed for having skills and kind of personality traits that allow them to be able to interact with all different types of people. And they have the kind of personality that allows them to remain calm and also responsive to the human who's handling them in lots of different environments. And there actually is a pretty wide array of animals that can potentially be registered as part of an animal handler team. They tend to be domesticated mammals and birds. So certainly dogs and cats, rabbits, guinea pigs, horses, parrots. Typically an animal, at least for the organizations with which I'm familiar, animals who engage in animal-assisted therapy will be adults. So they have to be fully grown and kind of matured, and so that their adult personality is known and understood. So no puppies, no kittens, etc. And no what you might think of as exotic animals and no wild animals. And there are a few reasons for that, some of which relate to the animal's welfare, and some of them relate to how much we know about how that particular type of animal communicates and whether we're able to understand what they're trying to communicate to us kind of in any given moment. The human animal, the handler, who is part of the animal handler team, needs to demonstrate that they understand and are able to be responsive to what the animal is trying to tell them with whatever communication modality the animal uses, and that they understand the treatment plan and will abide by kind of the rules of treatment and what guides clinical practice. Animals and handlers are registered and work as a team. So they'll practice together as a team, they'll be assessed as a team, and they'll work as a team. They're not interchangeable. An animal who's a non-human animal who's working in animal-assisted therapy will always be working with their particular handler. And kind of a really important thing to keep in mind is that the human handler, the person who's handling the animal, has to always be the non-human animal's advocate, and watching the animal, being responsive to the animal, and knowing if the animal needs a break, needs to be taken out of the situation, is too tired to be doing any interactions that day, etc. And so some specifics about the training and requirements to provide animal-assisted therapy. Again, for it to be therapy, there has to be a licensed clinician who has achieved whatever educational and testing milestones they need to be licensed. And then, as I mentioned, the animal handler team needs to demonstrate a specific set of skills and aptitudes. They'll be assessed and registered with a recognized organization in most cases, and certainly I would recommend that if you're interested in animal-assisted therapy, you look through recognized organizations to find where that is available. And then, of course, both the clinician and the animal handler team will participate in continuing education and practice, and they'll be reassessed and recertified at different intervals of time, so that it's clear that they're both still equipped to continue doing, offering AAT or animal-assisted therapy, and that their skills are still intact. And so, as I had mentioned, it's absolutely possible that the clinician, the licensed clinician, will also be acting as the handler, or the clinician might choose to work with a separate animal handler team. Either way, they will have to, for each individual client that might be interested in animal-assisted therapy, there are certainly a set of permissions that need to be gotten from the client, him or herself, from the place where the treatment is going to be happening, possibly from the client's physician, etc. So we want to make sure that all of those permissions are in place ahead of time, and certainly during the session, well, before, during, and after the sessions, there are certainly safety and hygiene requirements that have to be followed. And if the handler is not also the clinician, then certainly the handler needs to understand what's going to be happening in therapy and understand what the therapeutic process is, and also abide by, as I had said, kind of the healthcare rules, understanding about privacy and confidentiality and those kinds of things also. In terms of clients who are good candidates for participating in animal-assisted therapy, basically people who like animals and want to interact with them. If you don't like animals, or they make you nervous, or you just don't want to be around them, then you don't need to participate in animal-assisted therapy. It's certainly not anything that one should be forced to do if they don't want to. And people also need to be able to interact safely with the animals, both for their own safety and also for the safety of the animal. And in fact, for people who like animals but maybe cannot interact with them safely, clinicians can also consider something that's called animal-related engagement. And so just a few examples of things that people might do in animal-assisted therapy include, so if you think about kind of what the skill or the behavior is that you're working toward in treatment, an example might be that you want to be able to say or write more specific words and more types of words. And so what you might do as an activity to practice that with the animal, excuse me, is provide cues of increasing length to the animal. So asking the animal to do things. You might name concepts associated with the animal. And what the clinician is measuring is the language and communication, not specifically anything to do with the animal. So again, it's treatment, it's still treatment. It's just that one of the activities that's being incorporated is interaction with the animal. Another example is you might want to practice starting conversations with new people. And so what you practice with the animal is introducing the animal to new people, or being able to tell or respond to questions with different pieces of information about the animal. And again, what the clinician would be looking at would be things like the number of conversational turns you started, the number of words in your sentences, the number of reminders or cues that were given to the client. And then just a last example, if you were working on saying or writing sequences of directions, for example, you might write out a list of the animal's daily activities to provide to a pet sitter. So the activities that you engage in with the animal are explicitly designed to help you practice whatever communication or other skills that you're working on toward your treatment goals. And so just a little bit about the evidence that animal-assisted treatment can be a good thing if it's something that is of interest. A couple of things to keep in mind. The study of animal-assisted therapy is a relatively young science. And so it's still in relatively early stages of development. But we're definitely making good progress. And in the last maybe 10 to 20 years, we've really seen a lot of great progress. Another thing to keep in mind is that a lot of the evidence, there's a mix within the evidence base of information from different types of engagement with the animal. Some animal-assisted therapy, other animal-assisted activities. But in general, there is certainly evidence that interaction with animals in the context of animal-assisted interventions can be good for physical health, reducing blood pressure and reducing heart rate for people for whom they're too high. There's also a fair bit of evidence that interacting with a non-human animal can help with kind of environmental stress and coping responses and actually promote healing. One of the big neurochemicals that's studied is oxytocin, which is related to kind of that feeling of bonding and social affiliation with another being, as well as a reduction in cortisol, that kind of stress response. In terms of social emotional benefits, there is evidence that interaction with or presence of an animal can reduce social anxiety, increase positive mood. There's a fair bit of evidence that animals can act as social facilitators. Many of us who have our own dogs may have had the experience of knowing the names of the neighbor dogs, but not the neighbor humans, or having the experience of walking down the street and really only interacting with other humans about the dogs. And something that a woman named Andrea Beetz wrote in a recent article was that it seems like one of the things that's happening with interaction with animals in the context of treatment is that they promote the preconditions for learning. And that can be really helpful and important in the context of engaging in treatment activities. And so specific to aphasia, and here all of the evidence so far has been specific primarily to stroke, aphasia as the result of stroke. There have been 3 articles over the last couple of decades, and then a 4th was recently published. It was about animal-assisted therapy a little more generally, but there was actually a case report included of an individual with aphasia. And some of the kind of general findings, a summary of the findings across those studies, in all of those studies, the individuals who participated in the studies achieved the speech language goals that they were working toward, reported in some way increased motivation to participate in treatment, increased positive mood and enjoyment of treatment, and also in some cases more social opportunities and opportunities to communicate with other people. And as I said, this is really a field that is, I think, exploding and growing in a great way, not just in terms of the number of studies and the number of clinicians using animal-assisted therapy, but also attention to making animal-assisted therapy as the best that it can be relative to studying how it works. And some of that evidence will hopefully soon be coming from the Aphasia Center, the MossRehab Aphasia Center. So I didn't feel right doing an animal-assisted therapy talk without at least showing one slide that was full of animals. Here in my thank you slide, I've just included some photos of the dogs that we've had over the years. And that's about it. I'll look forward to hearing your questions. Thank you again for listening. And also, there are in I'm happy to share these with anyone who's interested. There are some references and resources, and then also some citations from the talk. So thanks again. I'll leave until Jen tells me to stop sharing. I'll leave the photos of my dogs up.
So thank you so much for sharing, Dr. Antonucci. I have brought my dog on.
Oh, yay.
I was getting jealous of all those dogs on your screen. Actually, do you mind stopping your share, because I'm going to share my screen a little bit later. Thank you. So this is my little dog. We love rescues. He's not a rescue, but we love rescues. And this is Howie. I almost called him Sarah too. I'm very sorry for calling you Sarah. I'm so embarrassed.
God is making our dog's paws.
Dr. Antonucci is such a big name in the aphasia world, so I'm just so mortified that I kept calling you Sarah. So I'm very sorry for that.
Oh, no problem. Don't worry about it.
So we actually have a few questions in our Q&A chat. The first question is, I'd like to use my dog in pet therapy at the hospital with stroke survivors. What would be the first steps?
So whether you are a clinician or someone who would like to do animal-assisted visits, either way, I would recommend that you look into whether there are the availability of training and assessment in your area. One organization that I am familiar with and have a lot of respect for is called Pet Partners. And their website is actually one of the resources in my little guide there. And so what you would want to think about is, does your animal, thank you, Jen, that's right. Does it seem like your animal would like that? Would they be interested in being around a lot of different people? Are they good at being with other people? Do people make them nervous? How do they feel about being in different situations? For example, going in to do a visit in a hospital, there's a lot going on for a dog in a hospital. A lot of loud noises, a lot of people coming and going, a lot of pretty large equipment, walkers and wheelchairs and a lot of different smells than they would be used to. So I think that is one big component of it. And then again, the other component, as I said, is seeking out some training to see if how well you and your dog, I believe the person said their dog. Is that right? Yes. Okay. This doesn't have to be a dog. How well you would work together in different contexts with different kinds of people.
Thank you. It looks like we might have a live question from Evelyn Finn. So I'm gonna put her on unmute. Let's see if she's gonna come on. Evelyn, are you there?
Hello. Oh,
Hello.
hi. How are you?
I'm fine. How are you?
Yes, I love dogs, but I'm more to the point. Oh, I lost my technology again. Any tips for technology? I'm thinking Apple, any one will work.
So if I'm understanding correctly, are you looking for technology that would help you practice communication, or technology that would help kind of communicate, say different things for you?
Both, actually.
There are certainly a number of different, for example, apps and websites that I could recommend, and that would help you kind of find some ways of practicing, and then also possibly some communication devices if that's something you need. Maybe I can either get your contact info or you can get mine, and we can touch base offline. And of course, yes, the NAA will have great resources as well. But I'm happy to chat offline too.
Yes, perfect. Thank you.
So Evelyn, if you want to just put your email address into the chat box, that will not be shared on YouTube. So feel free to send us your email address in the chat box. Thanks for coming on.
Sure.
Okay. So our next question is, do you have any recommended resources you could share about service animals for people with aphasia? Thank you.
So service animals, as I mentioned, is a very specific category. And the organization that I am the most familiar with that actually does training of service dogs is an organization called Canine Companions for Independence. And again, I'm happy to send that information to you. Those in those cases, when you're really talking about a service animal, it tends to more often be an animal who's been specifically selected and trained to do particular tasks, as opposed to someone training their own pre-existing pet or animal to become a service animal. But yeah, and I can I put things in the chat too? Can I add things to chat?
Yes, definitely.
And share it? Okay, great. Canine.
Oh, you know what? I think you might be under, just check your two, because it might be going just to host and panelist. So you want to change that to everyone.
Oh, okay, great. Everyone, there we go. And again, I'm sure there are other organizations besides Canine Companions for Independence. They're the ones that I am the most familiar with.
Thank you for that. Okay, so let's see. Let me share my screen real quick. Do you see the question on the screen?
Yes. Can animal-assisted intervention help with physical pain? So let me preface this by saying I'm a speech language pathologist and a person who works with people with aphasia. I'm not a physician, and I'm definitely not an expert in pain management. But I do believe, and for example, again, if you go to the Pet Partners website, there have been some studies looking at chronic pain management and interaction with animals, palliative care, work with animals, and then also some studies looking at the use of pain medications. But unfortunately, again, that's not my area of expertise, so I can't give too much information about that. Thank you for the question, though.
So this question actually comes from a speech language pathologist. She asks, what additional certifications are required to administer this type of intervention?
Yes. So in terms of additional certifications on, if you're talking about ASHA or your Cs, none. So there's no extension of the speech language pathology certification. What I do, of course, always recommend is that you are certified with an organization like Pet Partners that will help to provide training and also will do in-person real-time assessment of you working with your animal, and would then they don't certify, but they register animal handler teams and provide support and training to animal handler teams.
Our next question is, what should I look for in a therapist who works in animal-assisted intervention?
Well, definitely that they are a licensed therapist and that they are registered. If you're looking for someone, so let me back up. You want to know that in addition to the fact that they're a licensed certified clinician or therapist who has experience working with people with aphasia, you want to know that either they themselves are registered as part of an animal handler team, or that they have a working relationship with another human who can act as the handler as part of that team. And it's always great, of course, if they have experience doing animal-assisted therapy, because especially when the clinician is also the animal handler, there are a lot of benefits to it. There are also, a lot of things to juggle. And so it's great if the person has experience and also is in a setting that provides support for animal-assisted intervention.
So I'm going to go back to the live questions. Our next live question is, can cats be work in animal-assisted therapy? I thought I saw only canines and miniature horses could be.
So thank you for that clarification. The restriction of canines or dogs and miniature horses is for service animals, right? So that, again, those are animals that have been trained to do specific tasks for a specific individual. And they usually live with with the human for whom they're doing the tasks. So an example you may see out and about are dogs who've been trained to assist someone who is visually impaired, or dogs who have been trained to alert someone to an oncoming seizure or to a drop in their blood sugar. So that's a service animal, federally protected, allowed to go into any public space to provide their particular service to their particular human. In terms of animals who can do animal-assisted therapy, it's a much wider category. So definitely cats, dogs, bunnies, guinea pigs. I've seen parrots, I've seen horses, I've seen all sorts. as long as they are, and different organizations will have different kind of rules about which animals they will and won't certify, or excuse me, not certify, register. So for example, the requirement that the animal is a fully grown adult, a requirement that the animal is not a wild animal. So yes, there's a lot more. There are a lot more options for interaction with different kinds of animals in animal-assisted therapy than there are in service animals.
Wonderful. Someone asks, do you have an Instagram handle?
I do, but it's not one that is for professional use. Let's put it that way. But there are a lot of dogs on my Instagram, mostly shelter dogs who are looking for rescue.
As an SLP, how can I find a handler animal team who could come and work with me and my patients?
I would, and again, I'm using Pet Partners because I'm most familiar with them, but I would definitely look for organizations that are registering animal handler teams. Many of them, including Pet Partners, if not all of them, will actually allow you to search by location to see which animal handler teams are located in which region, so that you can potentially reach out to them, to the animal handler team directly.
Great. I'm going to go back to our pre-submitted questions. So our next question is animal-assisted intervention covered by insurance?
So animal-assisted therapy is covered by insurance because, again, it is therapy. It is being provided by a clinician who is helping you work toward your specific, in the case of aphasia, communication goals. The animal is, the presence of the animal and the activities that you're doing with the animal are just that, they're activities. Of course, and the clinician will describe what communication skills you were practicing, how you're progressing toward achievement of your communication goals. And of course, then they'll also document that animal-assisted therapy was one of the methods that they used.
I'm actually going to skip over the next two questions because they've been answered. Can you please, so you've talked a little bit about animal welfare in relation to animal-assisted intervention, but how can we tell if an animal is enjoying being around people?
Well, and so that's a great question. And that is why it is so critical that the animal and handler are working together as a team, because it's really the handler's responsibility to know how their particular animal that they're working with communicates, and within a type of animal, so within dogs, for example, dogs in general have kind of very specific ways that they communicate. When something is stressful for them, you might see them kind of turn their head away. You might see them yawn. You might see them actually backing up. And a handler is going to know how a type of animal communicates, but also will know how their specific animal in particular communicates, and will know, this maybe isn't a good day for this, for my animal. Is the animal not feeling well? Are they sick? Are they in pain? Have they just had some, procedure that is making them tired? Is the animal in the middle of a session and you can start to see, I think they need a break. We need to go out and have a potty break, or we need to go out and get some water. That's really the handler's job, is to be the animal's advocate, in all situations. And that's why when, for example, a clinician is working themselves as the handler, it's really important, for example, for there to be other people that they can access available in the setting. So for example, if the dog or the cat or the horse needs a break, that there's someone who can give that come and get that animal and give them that break, so that the clinician can continue doing the work of whatever is happening in the treatment session. You know, and I think another, in terms of animal welfare, you know, one of the very important points again is, if you're thinking about engaging in animal assisted treatment as a person who would be providing the treatment or as the handler, you really have to be honest with yourself about whether your animal is likely to enjoy that interaction. That's part of being their advocate, right? And I happen to know that none of my animals want any part of animal assisted therapy. So as much as I love it and would love to do it with them, me being their advocate means me knowing that it's just not for them because they wouldn't enjoy it.
Right. I really appreciate how you mentioned that the handler will know, we'll see in each individual dog what stresses them out and what doesn't. My own dog, this little guy, he shows his belly like he wants a belly rub, but it's actually, for him, it's a sign that he's stressed out. So
exactly. Yeah. Sometimes dogs will do what's called tapping out, like they're just done. And you know, and so another thing related to that is when an animal handler team are registered, there are different kind of levels of environments that they might be registered for. And so some animals will do really well in a real predictable environment, but in a more complex environment, they would have trouble. And so it's also knowing if your animal is appropriate for any kind of animal assisted intervention, especially animal assisted treatment, what environments are best and which are ones that maybe should be avoided.
Going back to some of our live questions, this person asks, do people taking in shelter dogs change the name of the dog? And if so, would it be great if they could name their new dog Aphasia? That's a great suggestion.
So yes, people absolutely take in rescue dogs all the time and change their names. A lot of times when dogs come into a shelter, especially, for example, an open intake shelter, where they're coming in as a stray, they, you know, maybe they didn't ever have a name and they only got their name when they came into the shelter. So yes, you definitely can change the name of a shelter animal. It might take, you know, teaching a dog the name that you want it to respond to is itself a task and a learning opportunity. And, you know, I have seen many, many dogs with many, many very interesting names. A personal favorite of mine is a friend of mine named her dog, who was a rescue, Pastina. Which, for those of you who are Italian, know what that is.
So our next live question says, I have aphasia and I know I'm going to pronounce this incorrectly. Homonymous hemianopia.
Yes.
Would it be a good idea to get a dog for support?
So just so everyone in the live, for if anyone is not aware, homonymous hemianopsia is a kind of, it's technically it's called a visual field cut. So it's a blind spot that the person has in their vision. So I think it would be a question of if you're actually thinking about getting a service dog, it would be a question and a conversation with people who train service dogs about what needs you would have that the dog would be able to fulfill, relative to whether it was for help with things like navigation related to visual difficulties, whether it could be a wide variety of things. The term, you might have noticed, I didn't ever in the talk say support animal. That is a very poorly defined and not really, there's no really agreed on definition of what a support animal might be. And you have to be a little bit careful because there are no kind of formal definitions. There are also sometimes, not formal, anyone can buy a vest that reads support dog and put it on a dog and say, oh, it's a support dog. There aren't necessarily guidelines or people kind of watching to make sure that the dog or the other animal is really appropriate to the person's needs.
You said that word so beautifully. That's why you're the expert and I'm not. Our next question is there
I've been doing this for a while.
Our next question, is there any research on how animal-assisted therapy can help persons with primary progressive aphasia?
That's an outstanding question. And to the best of my knowledge, there is not yet. But I think that is absolutely an important area to look into. There is a fair bit of work looking at animal-assisted treatment for individuals with Alzheimer's disease, for example, but not yet primary progressive aphasia.
And if someone is interested in participating in research, I know you mentioned that the science behind this is relatively young. If someone, whether it be a person with aphasia, a clinician, or a communication partner, do you have any advice on how they can get involved with research?
Sure, you can definitely contact your local universities. Especially if they have speech language pathology departments or communication disorders departments. There's also websites like Pet Partners will sometimes have information about who in the area is doing research, and they might even have posted flyers of studies that are recruiting. Another place that people can look is a website called clinicaltrials.gov. And that's actually a website where every study that has received federal funding has to register so that the public can look to see what types of studies are going on. And then you would just, in your search terms, you would look for animal-assisted therapy.
Great. Can you talk about the People with Aphasia Training Dogs program and how to get involved as a person with aphasia or as a therapist?
Sure. So the Person with Aphasia Training Dogs program is very near and dear to my heart. It's a program I developed. And it was first running as an activity of the MossRehab Aphasia Center Activity Center. And the program ran such that people with aphasia enrolled either with their own family dog or with, they became a volunteer. They already were a volunteer at a local shelter and worked with shelter dogs. And we literally trained people with aphasia on how to use positive reinforcement techniques to train dogs to do basic obedience skills. And so again, the program ran as an activity for several years. And then we not that recently, we were very fortunate to get some NIH funding. And soon the program will be running as a research project.
Didn't realize I was on mute. We're almost out of time, but I want to ask, what is one message that you hope everyone comes away with after tonight's session?
I guess, gosh, one is hard. I guess, well, let's call it a two-parter. Number one, that if you think that animal-assisted therapy is something that you would be interested in, it absolutely is a real thing, and there is real evidence for it. And you would just want to find, again, a licensed clinician with experience with aphasia who is either themselves or is working with a registered animal handler team who've gone through training and have been assessed and registered as a team. And then also that, and I think the questions, really reflect that people are thinking about this, that for clinicians who are thinking about incorporating animal-assisted therapy into their practices, that you keep in mind that you'll have dual priorities. Of course, your priority is always your client, but then also advocating for the animal who is assisting you in your animal-assisted therapy.
What a beautiful message. Thank you so much, Dr. Antonucci, for being here with us today. I really appreciate everything you've contributed to our community and for sharing so much of your knowledge with us today. And my little Howie he sat through the whole thing and didn't bark or whine.
What a wonderful boy.
Yeah.
Oh, dogs are wonderful.
Thank you so much. I'm actually going to share a few words from the National Aphasia Association about some upcoming events. So for those in our live audience, I just want to let you know that we have an upcoming Ask the Expert webinar, and this is a panel discussion with General Michael Hayden, Coleman Watson, Doreen Mendez, Chris Carpenter, and they'll be talking about life with aphasia. We'll also hear from Martha Taylor-Sarno, who is the founder of the National Aphasia Association, and Darlene Williamson, who is the president of the National Aphasia Association. We'll also be hearing from former Congresswoman Gabby Giffords. And those of you who have joined us before will know this. We have many online groups. They are all free of charge. We have some really great new groups coming up. We have Managing the Impact of Stress, Anxiety, Frustration, and Mental Health on Speaking and Swallowing. This is a monthly group for persons with aphasia. This is being led by Jessica Galgano, who is a speech-language pathologist with Open Line Speech and Communication in New York City. We also have How to Build Your Own Home program. This is a bi-monthly group that discusses innovative and fun activities to do at home to supplement your speech and language therapy. That's being led by Brooke Lang and Emily Boss at Integrative Reconnective Aphasia Therapy. We also have some awesome groups like Black American Aphasia Conversation Group, Professionals with Aphasia Connect, Parenting with Aphasia, Buzzworthy, and we have Game Show, which is a monthly games group. For more information on these online events, please visit aphasia.org/online-events. All of these groups are free, but the space is limited, so please sign up early. We would really love to see you there. If you'd like more information, you could always visit us on aphasia.org. And for more information on MossRehab, please visit www.mossrehab.com. And if you have any questions, email me at jen@aphasia.org. Thank you, everyone, for joining.
Thanks, everyone.
You have some lovely comments in the, let me stop record, but you have some lovely comments in the chat box.